Hi everyone and welcome to Surviving My Cancer. My name is Tiffany. I am a stage 4 triple negative breast cancer survivor with 5 years clear. So I had my very final scans done last week and they still came out absolutely no evidence of disease. At the end of this video I'll be talking about a free document I've got for you guys that outlines everything you need to know. So don't forget to watch that and you can learn how to go and collect that. So thanks for coming today guys. Don't forget to subscribe before we start on this video and hit the bell so you receive notifications when all my new content goes up. Today I'm going to be doing the second part of my video talking about a breast cancer diagnosis. So the first video was really how to get prepared for this and steps that I followed myself to get through it a little easier. And this video will be focusing on what to expect after your diagnosis or surrounding the diagnosis really, and as far as tests and everything like that. So this would have all started by probably detecting a lump or perhaps swelling or redness or something irregular there, and that's always how it starts. You would have gone to your doctor, I'm presuming, or perhaps you're just preparing now to get ready to go to your doctor, in which case this will give you an idea of the steps that may follow. When you get to your doctor, they will speak to you about your family history and they'll want to know everything about any other cancer that was in the family, who had it, and any details you can give them. So if you can have that information ready and prepared before you go along to your doctors, it certainly is a lot easier. It doesn't mean if other members of your family have had breast cancer that you're absolutely done for. It really doesn't mean that at all. So don't panic and think that if that's the case, it's the be all and end all for you. That's not. Your doctor will then want to send you for some testing just to check, because sometimes this is nothing to worry about. It could be a benign tumor, which is really no issue, it's not dangerous. Or of course it could be cancerous, in which case we need to jump on that as soon as possible. So your doctor will send you for testing. Now this could be lab tests, which would be blood tests or urine tests. This could be an ultrasound, which is the same as when you're having a baby and you go and lay on the table and they get the camera with the gel. It's exactly the same as that. It's not painful. It's working on undetectable sound waves that we can't hear, and the sound waves actually bounce off the tissue in your body and they project images, and this is how they're able to see masses or irregular areas there. So they might send you for an ultrasound. They also might send you off to get a biopsy. So I had both. My first call was to get an ultrasound, which I think if you've watched my first video, you may remember I mentioned it came back clear. There was nothing wrong. Thankfully, my GP sent me for a second opinion, and when I went to the different ultrasound provider, it actually came back with results. So I'm very lucky I got the second opinion. I then had a biopsy, and the biopsy is when they take a small sample of tissue and then they test it to find out exactly what they're up against. The biopsy came back, it was cancer. So this is how I got the solid diagnosis of cancer. Didn't at that point know what staging I was, don't know that till a little bit later, but the biopsy will let you know straight away whether it's just benign or whether it is cancerous. So after you've had these initial tests and you've come to the conclusion, or your medical team have come to the conclusion where it is cancer, they may send you for further testing. There are other types of scans and things they may do, or they may decide to sit down as a group and work out your treatment plan. So this is done with your oncology team and your surgical team, and they will sit down and work out exactly what they want to do with you moving forward, what the plan of treatment is and everything else. So you're generally not included in this stage. My team met, talked about what they were going to do, and then I was called in and updated and given all the information following by my breast care nurse. When you go through all of this, part of your oncology team, you have a breast care nurse. Well, at least in Australia you do. You probably spend more time with her than anyone else, at least in the initial stages, and she's there to answer any questions, give you support, anything like this. And she ran down the treatment I would be having and everything like that. And I later met with my oncologist who reiterated much of that information and also went into it more in depth. At this point, you need to be writing down all the questions you have. So when you've seen your breast care nurse or you've seen your oncologist and they give you information on the treatment and everything, you need to write everything down, go home, do your research, think of any questions you have for the next time you return. With me, they started my chemo very quickly. I had a lumpectomy straight away, which turned out the cancer was more extensive than they had thought. I went back the following Friday, exactly 1 week later, and had a mastectomy on the right side. And that was right on Christmas time in 2014. So right after Christmas in the new year, I started my chemo. So, they really didn't have a lot of time to waste because I was quite an advanced stage. The lesions were in my liver and in my lung. Everybody is different. They can find it very localized perhaps in the breast, in which case it's not such a worry, and it may not be quite so urgent to get the chemo and everything going. So, I can't predict what your treatment will be, but I can certainly let you know the types of things you're in for and what to expect. It's probably not quite as scary as you would think it would be. Most of the tests are pretty straightforward. They're not painful. There's really nothing to worry about. The worst thing is you do have to get injections and sometimes contrast or a very small trace of radioactive material that inject into your veins to go through to help them do the imaging. That's about the worst part of it, really. That there's really nothing to be scared of with these images. So if you're ordered all these types of tests, really don't panic. It's nothing that's going to hurt you, and it's nothing to be scared of. It's really just overwhelming, inconvenient, and long. So be prepared for a lot of these tests throughout this time and moving forward, because there's going to be a lot of them. Some of the different types of scans that you may be ordered to get, this may be in the initial stages when they're trying to diagnose you, or it will almost certainly be during and after your treatment to monitor the progression, if any, and what is happening with your cancer. The first one is an MRI scan. And MRI scans are a different way of looking at your body. It takes images in slices, and the images are then pieced together to get an idea of the image of the area and of your body. It's a very, very detailed image, so you can get a lot of information from that. Here, as I mentioned before, a very small amount of nuclear material is injected into your vein, and this travels through and actually collects in areas that are not quite right. So they're able to photograph these areas and see abnormalities and what is going on. So a type of scan you may get is a nuclear scan. Here you're given a very small amount of nuclear material which is injected into your vein. It travels through your body, and it actually collects or pools in certain areas of organs or bones, so they're able to get an idea of any abnormalities in these areas. The nuclear material will disappear within hours. Sometimes they say not to go around or near babies or very small children for a couple of hours, although these days that doesn't seem to be quite the same as it was years ago. And the nuclear material leaves your body when you go to the toilet, so you basically just pee it out over time, over the hours following your scan. The best thing to do is drink a lot of water and stay very hydrated, and the more water you drink, the quicker you'll flush that back out. There are no long-term effects really from that after a couple of hours. You just feel completely normal. There aren't side effects. Some people with the injections can feel a little bit of nausea, and you get a really strange sensation with this sort of contrast when they inject it into you. It sort of flushes a strange heat that washes over your body, and you can just feel it flush over you. It's a very strange feeling. It's nothing scary, and it doesn't hurt. It just feels really odd. So that's something to be prepared for. You may be sent to get a PET scan. So again, this is another type of nuclear scan. So you will be receiving a small amount of nuclear material which is injected into your vein. Works the same way. It goes all over your body and collects in certain areas. So a PET scan is used to detect high levels of glucose. So you probably will know, if you've done your research and you've received a cancer diagnosis, that sugar or any kind of glucose is really not great with cancer. It sort of feeds it. So cancerous cells use more glucose than healthy cells. So a PET scan will pick this up because it's actually looking for the glucose levels in your body. Another type is a bone scan. Bone scans again are another type of nuclear scan. You will receive that injection that goes into your veins. It travels through your body and will sit in the unhealthy areas of bone. The nuclear material will pool there and then show up these areas in the scan. Again, it's not painful in any way. The worst part is getting the needle. You just go on the machine and it will turn around you, and it takes a little while. I think it's in 2 parts. They take the pictures, and the whole thing probably takes around about half an hour to get all of these done. So you will be laying on the table with the machine around you for around half an hour to get the bone scan. Normally when I go and get my scans, and I won't be getting them anymore unless something untoward happens. I've reached 5 years, and my oncology team have made the decision not to get scans anymore due to the radiation and adverse effects from the scans over time. I would go in, probably say I went in about 10 o'clock, I would get a contrast injection and I would get my CT scan done, which is the scan that films your organs and takes all the pictures of your organs and internal areas there to check there was no spread or no recurrence. Then I would get a second needle, which is the radioactive material they would actually put in. So they're going to insert a cannula in your hand when you go in if you're getting both of these scans. They would then insert the radioactive material via the cannula. It would go through and they would remove the cannula, and then I would be sent home for a couple of hours, because you have to wait 2 hours before the bone scan for this radioactive material to actually go through your system and to work. I would then go back and get the bone scans, and then I was free to go home. So the whole scanning process took about 4 hours, although for 2 hours of that time I wasn't actually there. So this is the time it takes for the contrast to go through your body and work through in preparation for that scan. If you're only getting a bone scan, you will most probably go in, you'll get your injection, they'll put the radioactive material through your veins, and then you will probably be sent off to go and have a coffee or have some lunch and return, because it does take a little while for it to go through. So what happens after all these tests are done and they've actually come to a proper diagnosis that yes, it's cancer? Well, after this, as I mentioned before, your oncology and your surgical team will be meeting to discuss what to do with you. What action they take and how urgent it is will depend on your staging and how extensive the cancer is. Now, there's different options of how they may proceed. I personally had the surgery first, and then I started the chemotherapy afterward. But you may find, depending, that they may decide to do the chemotherapy first and then leave any prospective surgeries until later. Now, they often do this to minimize the chance of having to go through extensive surgery or a mastectomy unnecessarily, because a lot of times the treatment or the cancer can actually shrink those tumors down, or in cases even get rid of them completely. So there's no need for this extensive surgery. So whatever they decide to do will be decided by your medical team. Definitely you'll want to listen to them. They're the experts here, but don't be afraid to ask questions and have input. If you have things that you're not happy with, for sure do speak up at this time when they're telling you all about what they're going to do to proceed. Now, the treatments may be chemotherapy or radiation or both. I had chemotherapy, I was scheduled for radiation, but when they finished the chemotherapy, took my final scans and actually found that the cancer had completely gone. At that point it was 100% I was stage 4, because if cells are not cancerous, they won't disappear after the chemotherapy. So had they been just non-cancerous lesions, they would more than likely at that point have still been there. They cancelled the radiation and decided not to go ahead with it. There was no point, when there was no evidence of cancer, going ahead with radiation. It would have been unnecessary at that point. The radiation is not good for you, so I didn't end up having the radiation, although initially it was in my treatment plan. When you have the chemo first, it is referred to as neoadjuvant therapy, and this is where they actually give you treatment first to try and shrink or minimize the tumor before the need for surgery. After your treatment's been going a while and you've been a little way into your chemo or your radiation, whatever they've decided to do for you, you will be getting scans done to actually monitor the progression, how well the treatment's working, and generally what's happening there with the cancer. If they feel like the chemo or the radiation, whatever treatment you're having, is not working, this is the time when they will take another look at that and perhaps change your type of treatment. So you will be getting scans throughout and afterwards to monitor this. It will be ongoing. If you received a cancer diagnosis and you went through and had your treatment and it is completely gone, it doesn't just stop and you walk away and forget about it. This is something you will need to keep monitoring for quite some time. Dependent on your staging, if you're stage 1, it might be very, very different. Stage 1 has a 100% cure rate and you know, you're going to be just fine. If you're a higher stage, such as I'm stage 4, I need to monitor this for a good 5 years. I was going to see my oncologist every 3 months. It was just, and even in the later years when my scans changed to yearly, I was still seeing my oncologist very regularly. They take blood tests every time I go for the appointments. These monitor your markers, which can give an indication of whether the cancer is returning or progressing and what's happening there. So, you know, it is something that keeps on for a long time, all these appointments and everything. So my advice to you going into all of these scans and everything is, it's pretty simple. Keep a diary from the very first instance. You need to be writing down not only dates and what you had, but you know, what your pain levels were, what you felt, any information you're given. Absolutely everything needs to go in this diary. You will need this information later. And if you have one book with everything written in it, believe me, it's so much easier to actually get your information together than scribbling around going through buckets of paperwork afterwards. That is just not good. You'll want to take time to get lots of sleep. Make sure you're hydrated. When you go to these tests and have to have these blood tests, it's really difficult, especially if you don't have fantastic veins. Once you start your treatment, it does affect your veins, this chemotherapy. Your veins will never be the same again, probably. So you need to be very hydrated to go and be able to find a vein to put this in. When you start and you're going into your treatment, something I forgot to mention, your oncology team or your doctor may advise or recommend you get a port put in. Now a port is when they actually put, it's a little round disc type of thing, and it goes under your skin and connects directly to your main artery, so that when they're needing to take blood or when they're needing to give you the chemotherapy drugs, for example, or anything like that, they can actually access your vein directly through the port. So I got my port at the same time as I was in getting my mastectomy, when they found out the lumpectomy wasn't going to work. And I asked my breast surgeon to actually have it inserted at the same time. You don't have to do this. This made it very easy for me because I was already in surgery and already out. And I'm very glad I did it that way. So perhaps that's something to think of. If you're going for surgery prior to your treatment, perhaps ask to get it done at the same time. Otherwise, you make an appointment and you go in to get your port put in, and it is something that is a procedure. It's only a little day procedure type thing. You don't have to be admitted, but it's not the most pleasant thing to have to go through. So yes, I would recommend, if you're having surgery, ask to get it done at the same time. So this is something you can plan for. The port stayed in with me right through till I got my scans following the end of all my chemotherapy, when they found that I was completely clear. Bear in mind, you know, my scans weren't done backing right up to my chemo. My scans were done a couple of months when the chemo finished. And by this time I had been taking 2 months worth of supplements that I had researched. So I will be sharing a list of these supplements next week. I'm in the final stages of getting that video together. So make sure that you subscribe and hit the bell so that you receive notifications as soon as I upload new content. I will be letting you guys know what all of these supplements were that I took. Again, bearing in mind, I am not a doctor. This is not medical advice at all. It's purely just a list of what I did and what I took. Now, did these help me become cancer-free? Well, we're never going to know that, will we? Because it could have been the chemo, it could have been that, it could have been both. I don't know, but you know, I took an awful lot of these things, and when they had the final test done, I was indeed clear. And you know, stage 4, that is unusual. It's not unheard of. There are a lot of us walking around out there that are clear, but it's, you know, as I said, we'll never know. It's just one of those things. So guys, I've put together a free list on your way to healing, which I'm going to give to you all. I've got a link down below, so all you have to do is click the link and pop over and you can pick that up. it's quite good, and it is a list I myself followed. So that is for you guys. I hope it's helpful. I am doing this to help you and to pass on all the information I learnt during this. I would like to see everyone out there walking around cancer-free, whether you're stage 4 or not. My next video on all the supplements that I took will be coming out next week, so keep your eye out. Right now, don't forget to go and click the link down in the description to pick up your free list on moving forward with your healing and what to prepare for. So thanks everyone for watching, and I'll talk to you soon.